Hello, my name is Heather. In today's class, we're gonna do some movements, some kind of gentle, easy, hopefully work for rehabbing from surgery, from hip replacement surgery. So, you know where you are in your progress and in healing and how you feel. Healing's not linear. You might be feeling good today, maybe you feel worse tomorrow. All that stuff is fairly normal in the healing journey, no matter what type of surgery or what type of injury we're healing from. So keep that in mind. Maybe you do this today and it feels great, and then you do it again and it feels awful, and just really honoring how you feel in the moment. If anything makes you uncomfortable as we're moving, or hurts, or is giving you the feedback that maybe you should stop, please listen to those cues. And then also I want to be sure that you are cleared by your doctor or whoever's caring for you, your physical therapist, to do exercises like this. So kind of yoga-ish, but really coming from sourcing just rehab exercises for our hips. So let's get started. If you have a blanket or something soft to lay on, I think that might be a nice thing to do, just to pad where you're going to be working. And then we're going to start out on the ground. So laying on your back, laying flat, and we'll just take a moment here. Arms at your sides. If you feel comfortable with it, you can close your eyes. If your eyes aren't ready to close, you might just stare up at the ceiling somewhere neutral, somewhere you can rest your eyes without thinking too much. And here we'll just take this moment to receive the feedback from our environment, the temperature of the space that we're in, the smells that we can smell. Noticing what you can hear. And really starting to feel the ground, the sturdiness of the floor underneath you, holding you, so that you can truly release, relax into the floor. Our muscles have this ability to do what's called guarding when we have an injury or when we have any trauma to the area, including a surgery. So as we're moving today, you might notice that the muscles are feeling tighter than usual. That should make total sense. Or that maybe you're having a hard time even communicating with those muscles to get them to work in the way that they used to. That should just make sense. That's all part of the healing process. But it's going to be other places that you notice that are tight, or maybe not getting the message as quickly. That might be more shocking. So as we're moving, just noticing those spots and just trusting in this healing process. It's all going to work out. So again, just noticing where your heels are and feeling the floor, really feeling the ground underneath your heels. Feeling the steady firmness of the floor underneath your calves, underneath your pelvis, underneath your upper back and the back of your arms and hands, and feeling for that steady firmness of the ground rising up to hold the back of your head. Just imagine you can let that top side of your body melt down into the steady firmness of the floor. Just allowing yourself to be completely held here for a few minutes or for a few moments as we begin to come to our breath. Just kind of noticing how you're breathing right now. And if you can, breathe through your nose on your inhale and your exhale. If you've got a stuffy nose, then you're going to need to breathe through your mouth. And just sort of dropping into the rhythm of your own breath as it is right now, noticing it. Noticing if your breath is up high in your chest or maybe lower toward your low ribs. Maybe you're sort of a seasoned pro at this this breathing stuff. Maybe you've already slipped into some deeper breaths. And if you've done that, you didn't have to do that. But if you've done that, just notice that you did it. And if you'd like to stick with it, you can. Otherwise, you can just breathe normally. Begin to make ankle circles. So ankle circles when you're laying on your back are kind of funny because we've got the ground underneath our heels, right? So just noticing that difference between if you're used to doing these with your feet in the air. And then go in the opposite direction with your circles. Some of the things that we do, you might not directly correlate with your hips, but so much of the movements that we make are coordinated, coming from our pelvis, coming from our hips. So even here in the hip circles, you might be able to notice that subtle engagement happening at your hips as you move your ankles. Okay, now I'm going to have you point your toes and then flex them back towards your heels very strongly. Okay, so when you point your toes, you might start to feel like you're going to get a calf cramp. Really go right into the opposite with the heel pushing forward and the toes pulling back if you start to feel that happening. Okay, and then just let your legs relax for a moment, just totally feeling the firm steadiness of the floor underneath you, allowing your legs to be fully held. Maybe you can feel for or notice how your feet are right now. They might be sort of like turned outwards a little bit depending on the position of your hips. One might be turned out more than the other depending on the position, literally, of your hip sockets. We're not needing to change that. It doesn't need to be a different way. We're just noticing if we can feel that. You might even lift your head and look at your feet. Just kind of notice what's going on down there. Now I want you to start to turn your toes out to the side even more. And then turn your toes all the way in to point at each other. Turn your toes out. So feet need to be at least hip distance apart. And then turn your toes in. And this seems fairly simple, but really so many of the muscles at the highest point of our hips are involved in this action. So it might seem simple at first and then get kind of hard. A few more times here. Just turning your toes in and out. Not really worried about how far. I mean, we are kind of trying to do it to our edge. Like now. Start to do this just with your right leg. It's a little bit of the brain teaser to do it just with one leg for some reason. And you might notice more engagement at your thigh. Just notice what you notice. Really feeling into the hip or what's going on there. And then do just the left foot. Notice if you start to hold your breath or squeeze your shoulders or squeeze your eyes even. And then you can let that leg be still. Let's just take a second here, take a breath. Okay. Bend your knees and place your feet on the floor. And we're going to do some pelvic tilts. So this is a very sort of subtle rocking motion of our pelvis. I want you to tuck your tailbone, if you know where your tailbone is, that very tip of your tailbone, your coccyx, toward the floor. When you do that, you'll feel your lower back just above your butt lift slightly. And then do the opposite, tuck your tailbone up toward the ceiling. You'll feel your feet get heavier on the ground and the middle of your back gets heavier on the floor. Kind of the top of your butt sort of lifts a bit. Okay? So going back and forth. So we're not trying to lift our butt, it's just that the tucking of our pelvis when we tuck our tailbone up, coccyx up, actually kind of lifts our butt slightly. So just a few of those. That nice rocking motion here in our pelvis. Getting some of the hip flexors and extensor muscles as we move. You can close your eyes if you'd like. And just breathe your breath steady, slow breathing. Last few times. Okay. And now really gently, you're gonna windshield wiper your knees from side to side. So taking your knees to one side and then the other. With a little bit more control than I would normally teach these. I want you to go kind of slow and really feel and think about how your legs move side to side. You might notice how the weight transfers in your lower back, the top of your butt area, and really feel that top of your pelvis receive the weight from side to side. And just try to be curious here. Notice the movement at your feet. Okay. And then if you can, you're going to bring your feet a little closer to you. And feeling for that right foot on the floor, I want you to push your right foot away from you, keeping your foot on the floor so you're kind of sliding it forward. Eventually you won't be able to keep your toes on the ground anymore, they'll start to lift, then just your heel. And I want you to keep pushing your heel along the ground. Push, push, push until you're flexing your toes back towards your shin. And then you're going to come back just the way you came. So you're going to start to drag your heel back. Eventually your foot will be able to come back onto the floor. And now doing the left side, so left heel pushes forward, your heel drags along the floor, and then you pull your heel back, so now you're in that sort of bridge pose prep position. Okay, I'm gonna move my blankie, get it out of the way so it's not there. You might need to move your blanket too. But, so right foot starts out flat on the floor with knees bent. You're gonna push your foot forward, eventually lifting your toes, pushing your heel forward, and then start to bring it back. Eventually your foot can come back to the ground. You're going to pull it all the way back till your heel's close to your butt again, and then start that left side. So you keep your whole foot on the floor until you can't anymore. Eventually your toes lift, and then you're going to push your heel forward, flex your toes, really kind of stretching that leg forward, and then start to bring it back. So let's start to accentuate this a little bit. You're going to push your right heel forward, eventually your toes lift, and then really stretch and even kind of lift the left hip as you push your right heel away from you. And then as your right leg comes back, your hips will even out again. Eventually your toes come to the floor. So you're going to push your left foot forward, keeping it on the ground. Eventually the toes lift, you push your heel forward. And then you're going to kind of squeeze that right hip towards your right low ribs, kind of push your left heel even further. So we go into like a side bend-ish on the right side, so the left leg, left hip, left lower back can stretch even more. So let's do that side to side. You're just going to go nice and slow, just adding the hip lift of the opposite side. So if your left leg is straight, your right hip is squeezing in. And just a few more of those. Kind of like we're marching on our backs a little bit. Okay. So finishing up that last side, and go ahead and start the next position, just laying flat on your back. Take your breath, really feel for the ground underneath you, the coolness of the floor, maybe the warmth of the floor if you're lucky. Take a deep breath. Okay. So starting with your feet hip distance apart again, you're gonna point your toes up toward the ceiling. This one, it might be like really especially that you don't really necessarily want a blanket underneath you, I guess, because we're gonna try to use that sliding again. But you're on your back, legs are flat on the floor, and this is a lot like tree pose, vrikshasana on the ground, but you're gonna keep your toes up, but now, keeping your left leg as it is, turn your right foot out to the right, and then bring the bottom of your right foot to your left ankle. And then slide your right foot up your left leg, coming up towards your thigh. Really, you're gonna get to wherever you can get. And then slide your foot down your leg, inner left leg again, until your leg can straighten completely. You can push your heel forward and flex your toes back. And now turning your left foot out, bring the bottom of your left foot to your right inner thigh, inner calf, all the way up. And then slide it back down your leg. So you're actually literally touching your foot and thigh and calf together. And then your leg straightens, your heel pushes forward, your toes flex back. So we always return to this heels pushing forward, toes flexed position, okay? So right foot turns out, right foot comes to your left ankle, slide your foot up your leg. Try not to lift your right knee, push your foot forward until your heel pushes forward, and then flex your toes. Bottom of the left foot touches, slides up, slides back down until you can straighten your leg and flex your toes. Okay, so a couple more. Right foot turns out first, slide up, slide back down, turn your toes up, left foot out, slide up, slide back down, left toes flex. Last time, right foot out, slide up, and come back. Toes flex, left foot, slide forward. Awesome. Bend your knees, place your feet on the floor. Roll over to your right side. Now, it might not be comfortable to lay on your side yet, and if that's true for you, you can sort of fast forward through this, and eventually we're going to be at the chair, so you can stop the video when you see me standing up to go to the chair. Otherwise, I do recommend getting a blanket for underneath your right hip. Just give yourself a little bit extra padding. And then really with the upper body, you can bend your elbow, support your head with your right hand, or you could even lay if you're feeling really tired, okay? You're gonna bend your knees to about a 45-degree angle from your hip, and then keeping the big toe side of your feet together. These are called clamshells. Very classic hip rehab exercise here. So you can keep your left fingertips on the floor for balance, hand on your hip, really wherever it feels good. But keeping that big toe side of your feet together, lift your left knee and then bring it back down. Okay? So you're gonna do that a couple times, lift and come back. And you're just breathing as you move here, trying to maintain that contact of the big toe side of your feet. So your heels are touching, your big toe mound is touching, maybe your big toes are touching. And with any of these exercises, if you get tired, if it's too much, you're just gonna pause, maybe come back to it, and maybe just wait it out. Maybe fast forward, okay? One more time. Go ahead and keep lifting, holding, breathing. And bring your knee down. Take a little rest, take a breath. And now straighten your legs. So when we straighten our legs here, there's a feeling of being out of balance. It also might be a lot for that hip. So if you want, you can keep trying to do this, or maybe lean back a little bit so you're more on the fleshy part of your butt and not so much on the boniness of your hip. So legs are straight, toes can be flexed here. I'm gonna have you bend your top leg, so that would be your left knee, and place your foot on the floor behind you. And then with your right leg, keeping your toes flexed, you're gonna lift that right foot up and then bring it back down. And we'll do that a couple times. Lift and bring it back. And breathe. Try not to do this so much with your face or your butt. I mean, your butt is working, but maybe that area at the tip of your tailbone doesn't need to work so hard. Just a couple more times here. Breathe. Last 3 times. So on this last one, I'm going to have you lift your right leg and just try to hold. Take a breath. And then let your leg come down. Okay, so let's switch sides here. So your left hip will be on the ground, or if you did the wrong side, just switch sides. And again, so we're going to start out on our hip. Our knees are at about a not a right angle, a 45-degree angle from our knees are about a 45-degree angle from our hips. You can either kind of lay on your arm here and do these clamshells with your head on the ground, or maybe you feel like supporting your head, right hand on hip, or right hand on the floor. Okay, big toe side of your feet stays glued together. Lift your right knee, and then bring it back down. It's really not about how high. Like we get these things in our head, like bigger is better, right? But we're really just the engagement's happening no matter how high you lift your leg. And sometimes smaller movements actually require a little bit more of us, a little more subtlety, makes us have to concentrate more. Remember to breathe as you move. Just a few more here. Again, trying to keep that big toe side of your feet together, your face soft, your breathing steady. It doesn't have to be deep breaths necessarily. And just be really interested in like how tired your legs are getting, where the difficulty is for you, and like also maybe you can feel it in other places. Maybe you're noticing your tummy has to work, or your lower back is also working. Okay, let that top leg just rest. Totally soften your glutes, your lower back. Straighten your legs, flex your toes. Bend your top knee, your right knee, put your toes on the floor behind you. And from here begin to, maybe it's your left hip that's super sensitive. You could lean back a little bit more onto the fleshier part of your glutes. And then lift your left leg and bring it down, okay? So again, you're doing as many as you can today, right now. And that doesn't mean that's going to be the same tomorrow. We're really just taking our healing journey one day at a time, right, guys? I've healed after many things, but physical things. I've healed after 4 births, vaginal births, and then also my hysterectomy and excision surgery. And yeah, it's no joke, healing. Healing has highs and lows, but it's all going in the same direction. Okay, last few times. That last one, next one, go ahead and hold, breathe. Another breath. And then let your leg come down. Okay, so we're gonna keep this blanket underneath us. Roll onto your tummy for a moment. Rest your forehead on the ground. And bring your arms next to your sides with your palms up. One cheek on the floor, and just rest for a moment, really allowing your whole backside to soften. And switch cheeks. your elbows underneath you, underneath your shoulders. And then once your elbows are underneath you, your hands can kind of be wherever they feel comfortable here. So I've got you in sort of a back bend already, just in this position. We tend to be in a back bend. Make sure your elbows are underneath you, you're not kind of collapsed toward the ground. So use some muscular engagement here, push your elbows down, lift your chest. Now bend your right knee and push the top of your left foot into the ground. And pretend you've got something on your right foot, so flex your right toes. And you're gonna lift that thing up into the air. And then bring it back down. And now take your right knee out to the right, still kind of keeping this same position with the leg. And then you're gonna come back and lift while you press the top of your left foot down. Bring your thigh back to the ground, and then take it out to the right, bringing the side of your foot back to the floor. Just do that a couple times. And this movement might be much smaller than what I'm doing, especially this turning out to the side. It might not be that you're able to get your knee all the way out and the side of your foot to the floor, but somewhere in there. Just a few more. Okay, stretch your right leg straight and now push both of your feet down, lift your chest, take a breath. Okay, so left side, you're gonna bend your left knee, press the top of your right foot down, and then flex your left toes towards your shin a bit. Now lift your left thigh, and then take your left knee out to the left. A little bit or a lot, maybe bringing that big toe side of your left foot to the floor, and then come back and lift. Bring it down, take it out to the side. Okay, and just kind of a playful movement here. It doesn't have to be perfect, but we're really trying to get that outer movement, the outer hip movement, and then the lift of extension. Last few times. So the muscles of our hips do quite a bit of movement at the hip joint. They turn our leg out to the side, they turn our leg in. They bring our leg closer to our body, they take our leg further away. So in the front, they bring your knee to your belly. In the back, they take their leg back behind you. So that's flexion, extension, and internal and external rotation. But also your leg moves out to the side and it comes back. So that's abduction and adduction. So quite a few movements there at the hip joint. Last time. Okay, and then back to, this is actually Sphinx pose, if you're familiar with that. You're pressing the top of your feet down, push your elbows down, lift your chest. Go ahead and look up, take a breath. Okay. Let your head come down, take your hands a little closer to you, and then push into your hands and knees, lift your belly. Come up to hands and knees just for a moment, and then you're gonna need like some sort of surface that you can stand by. It could be that you have a chair, but maybe you have a wall, or even a countertop, or even like a couch, okay? A few movements at the chair before we are done here. You're gonna take your hands to the back of the chair, just to sturdy yourself, or the counter, or whatever thing that you have. And then bring your feet pretty close together underneath you. Bend your knees a little bit. And then you're gonna take your right leg out to the right, back behind you, and then take the pinky side edge of your right foot somewhere near the pinky side edge of your left foot. And then bring it back out to the side, or back behind you, out to the side, and then in. So from the front, it looks like this. So now you're doing your left side. You're gonna take your leg out to the left, and then go back behind you. Try not to lean forward. Bring it over to the right, and then slide it up somewhere so that your pinky side edge of your feet are kind of close. Maybe you can get really close, okay? So now right side, lift your leg up, take it over to the left, pinky side edge, lift it back up, out to the side, and it comes in. left leg, I think I went out to the side first. So you go out to the side, lift it up behind you, come over to the right, slide it forward toward the pinky side edge. Uncross your legs. Right leg comes out, goes back, cross your legs, comes back, comes forward again. Okay, so somewhere in there, left leg goes out to the side, take it back behind you, try not to lean forward, pinky side edges of your feet meet, lift it back up, and come back. Right side, leg comes out to the right, swing it back, pinky side edges of the feet, bring it back out, and down. Left side, left goes out to the left, swing it straight back, pinky side edge of your feet, coming back, and together. So let's do one more time each side. Right leg goes out to the right, swing it back, pinky side edges of your feet meet, lift it back up, feet come together, left leg comes out to the side, swing it back, pinky side edge of your feet meet, lift it up, and come back. That's awesome. Turn your chair or sit on a surface so that you're sitting sort of on the edge of the chair. Okay, so from the edge of the chair, you can keep holding on to the chair if you'd like to. This just makes people feel a little bit more sturdy. If you're feeling sturdy, you could do hands on thighs or even hands at your heart. But to begin with here, you're gonna lift your right heel and then bring it back down, lift your left heel, bring it back down. So we'll just start with this, seems fairly simple movement. Just lifting the heels one at a time. Okay, so let's add a little bit. You're gonna lift your right heel, lift your right knee, and then step your foot out to the right. Lift your right heel, lift your right knee, and then bring it back. Lift your left heel, lift your left knee, take it out to the left, set it down. Lift your left heel, lift your left knee, bring it back, okay? Feet start out underneath your ankles, underneath your knees. Now lift your right heel, lift your knee, take it out, set your foot down, lift your heel, lift your knee, and bring it back. This movement could be much smaller, so say it's lift your left heel, lift your knee, take it out to the side, lift your left heel, lift your knee, bring it back. So it could be very tiny. Right side. And just that little bit of like, oh, I have to think about lifting my heel first. It's not so much that it's like a right way of doing it, it's more a cue to make you have to think about the movement. If you have to think about stopping to lift your heel first, you're more likely to move slower and with more awareness. One more time each side. Great job. Okay, so lean forward. Let's do this one from the side too. You're sitting on the edge of the chair, ankles are underneath your knees. You're gonna lean forward so the front of your pelvis comes a little closer to your thighs. Your butt sort of feels like it's lifting a little bit behind you. So you could do hands on your thighs here or hands at hips actually. So we're doing chair pose in a chair. But hands at hips or hands at thighs technically. Maybe hands are in front of your heart. That's a little bit harder. Maybe you feel like you want to reach your arms up. We're going to be here, really start to step into your heels and get the sensation like you're going to stand up, but you're not going to stand up. But pretend like you're going to stand up from here. Take another breath. And then release. Awesome. Bring your heels a little back so that you can stand up a little more easily. Move the chair. I'm gonna let that go now. If you like to have a chair to help you get back down onto the floor, you can always reach onto the bottom of the chair, the sturdy seat part, bend one knee, lay that shin on the ground, and then the opposite shin, and then you're on the ground. We've reached the final resting point. I know you're probably resting a lot, but are you resting with resting in mind? So I want you to do this rest, even if you feel like you're resting a lot. If you have something, a pillow, whatever you've got, I'm gonna have you place that underneath your knees. And then if you have a blanket, I'm gonna have you put that underneath your hips. And then from here, resting your arms at your sides, that bottom half of your body nice and supported. You can close your eyes. Maybe you have something to cover your face or your eyes. Maybe you have something to lay across your chest, something heavy to make you feel even more grounded here. We'll just take a minute or so just to really allow ourselves to rest. Trusting in the wisdom of the healing process of our body. And then we're just sort of along for the ride. With faith, with trust that things are going exactly as they should, and that we're doing what we can to assist, to cultivate or nourish that healing process within us that happens naturally. You can let your deep breathing go, really feeling for that steady firmness of the ground underneath your skull and allowing the full weight of your head to be held by the ground. Same thing with your chest, your upper body, your arms, just allowing that full weight of your upper body to sink into the firmness of the ground. Feeling for the muscles around your pelvis, the deep muscles that line the bowl of your pelvis, but also those short muscles that surround the socket, the longer muscles that connect your pelvis to your legs and to your upper body. The group of muscles that overlap and intertwine to create our pelvic floor. And the long muscles of our thighs. Feeling for your knees and the bones that meet there. Our largest, heaviest bone, our femur, connecting down into two smaller bones through the patella to the tibia and fibula. Fibula. Letting these smaller muscles relax all the way down into your ankles, just allowing for your feet to drop. Feel free to stay as long as you can stay. Otherwise, starting to gather yourself up. Feeling around for your breath and your awareness again, noticing the temperature of the space you're in, the feeling of the floor underneath you and the clothes on your skin, the breath in your lungs, the light that you can perceive even with your eyes closed, the sounds in your space. Starting to bring some movement back to your fingers and toes, your ankles and wrists, your head moving side to side. And when you feel ready, coming up to seated. Thank you so much for trusting me to guide you through this class. I hope that there's some enjoyment to be found in this process of healing, and that I have other videos that might come after this for hips that aren't necessarily specific to surgery, but once you've been cleared, you can do what you can do, and just keeping that in mind as you go through your process, that you're doing the best you can and your body is healing always, even when it doesn't feel like it. Just trying to trust in that process. I know it can be hard. Thank you.